Welcome to the 2021 Tennessee Pharmacists Association Awards celebration. We're honored and delighted to have you all join us to celebrate the accomplishments of all of our wonderful pharmacy professionals and dedicated patient care advocates. As this past year's TPA president, it is an honor to recognize the accomplishments we have achieved for the profession over the past year. We also want to thank everyone that submitted award nominations. While this award ceremony highlights the great work being done by individuals and organizations here in Tennessee, it is also important to note that everyone in attendance should be commended for your daily efforts, often unsung or unnoticed, to improve the health and the lives of your patients. It is not every day that we can all pause to recognize such a distinguished group of individuals who work hard every day for their patients and to better this profession we all love. Recognizing all of their individual accomplishments would take quite a bit of time. So hopefully you can find some time to speak with them once we are able to meet in person again. We are grateful to Morris and Dixon for their support of this year's award ceremony. Morris and Dixon is committed to independent pharmacy. TPA thanks Morris and Dixon, and specifically Fonzie Brown and Jim Brown, for their continued support for TPA and our members. Thank you again for joining us as we honor this year's selected individuals and organizations that have positively impacted our profession, our association, and most importantly, patients in Tennessee. We will begin our awards program this afternoon with 2 awards given out by the TPA Board of Directors. The first award given by the TPA Board of Directors this year is the Barbara McAndrew Herald Award. This award is generously supported by Dr. Paula Bailey Henson and is given out in recognition of Barbara McAndrew, who served as the first consumer member of the Tennessee Board of Pharmacy. During her time as a consumer member of the board, Ms. McAndrew actively promoted the profession of pharmacy and the ideals of pharmacists providing care to the public, to the business community, to the government, and to our other healthcare providers. This award is for those who have followed in her footsteps. This year, we recognize a familiar face in the TPA office, Ms. Shauna Lightfoot. On June 25th of this year, Shauna will have worked as controller for the Tennessee Pharmacists Association for 20 years. In her role, she has gone above and beyond for TPA members, as truly bought into the mission and vision of the organization. Since originally being hired by Dr. Patina Black and Dr. Roger Davis in 2001, she has been through many ups and downs in the organization's history. Previously working for the Tennessee Primary Care Network, Shauna helped bring TPA's financial records into the 21st century. Originally from Portland, Tennessee, Ms. Lightfoot lives in Hendersonville and is active in the Temple Church of Nashville. The TPA Board of Directors is proud to honor Ms. Shauna Lightfoot with the Barbara McAndrew Herald Award.
20 years at TPA. I'm truly honored to receive the Barbara McAndrew Award for 2021. What's more impressive is the TPA staff kept this a secret for 6 months. Now, during the past 20 years, I met some wonderful pharmacists and their families at various meetings. I remember thinking, I'm at the right company when Sherry Hill handed me her credit card in Chattanooga and said, use this to take the staff out for dinner. I had only been on the job for maybe a couple of weeks. They must really trust me. So God willing, no way I'm ever going to let TPA down. It's moments like this year after year that I feel it's important for me to do my job with honesty and integrity. Although I harass my coworkers about paperwork to back up expenditures or time off, I only do so to keep my books tidy and in order. I do my job to glorify God and to prove that your trust in me is not wasted. Thank you, TPA Board of Directors, for this award.
Congratulations again, Shauna. Thank you for all you have done. The next award is the Shelby Reinhardt Public Service Lifetime Achievement Award. The Shelby Reinhardt Public Service Lifetime Achievement Award is given by the TPA Board of Directors to recognize individuals supportive of the pharmacy profession through legislative and service efforts. This award was named in honor of the late pharmacist and state representative Shelby A. Reinhardt, who served 36 years in the Tennessee General Assembly. This year, TPA is proud to award Dr. Bill Green with the Shelby Reinhardt Public Service Lifetime Achievement Award. Dr. Green received his BS in pharmacy from the University of North Carolina and his PharmD from the University of Tennessee Health Science Center. He currently serves as the Chief Pharmaceutical Officer for the St. Jude Children's Research Hospital in Memphis, Tennessee, and has been active member of the Tennessee Pharmacists Association and Tennessee Society of Hospital Pharmacists for over 30 years, serving as president of both organizations as well on numerous committees throughout the years. He is a fellow of both the American Society of Health System Pharmacists and the American College of Clinical Pharmacy, and has written numerous journal articles, commentaries, and book chapters. Dr. Green has also been heavily involved in many regulatory and legislative priorities in the state of Tennessee over the years. He was instrumental in the passage of the Collaborative Pharmacy Practice Law in 2014. Dr. Green's passion for TPA and for advocating for the profession are seen by all those around him as he encourages other pharmacists and pharmacy professionals to be involved in TPA and their profession, knowing that they can make a true impact. The TPA Board of Directors is proud to honor Dr. Bill Green with the Shelby Reinhart Public Service Lifetime Achievement Award.
Hi, I'm Bill Green. I'm currently Chief Pharmaceutical Officer and member of the Department of Pharmaceutical Sciences at St. Jude Children's Research Hospital. I've been a pharmacist in Tennessee since 1982. I want to recognize the leaders of the association for their effectiveness in leading TPA through a very challenging year. Congratulations on taking us through the pandemic and for guiding us through the transition of leadership which has occurred. I'm very grateful to be able to accept the Shelby Reinhart Lifetime Achievement Award. As you know, this award recognizes individuals who have shown support of the pharmacy profession in Tennessee through legislative and service efforts. I'm honored to be recognized, especially when I consider prior recipients of the award such as Glenn Farr, Senator Farrell Hale, Paula Henson, and Bettina Black. These individuals all made an impact on the profession in our state, and I'm really honored to be included in that list. My engagement in various offices and roles of TPA has been a great blessing to me. Many motivated pharmacists dream of making a positive impact on their profession. Since many of the regulations and forces which impact our ability to practice are driven by regulations and limitations which are defined at the state level, not the national level, it simply makes sense to become involved in TPA. We must remember that if you don't get involved, someone else sets the rules by which you practice. I also want to encourage you in saying this, that when opportunity comes, please step up. There are many remarkable pharmacists in Tennessee, pharmacists who practice in all types of professional roles. I've been so blessed to get to know some of you well, to learn something beyond myself and my selfish perspective, and to be encouraged to be both a better professional and a better person in that effort, simply by learning from you. I wish only that I had been more teachable and more ready to interact with you at an earlier stage in my career. Thank you for this very special and significant honor. Best wishes to you all.
Congratulations, Dr. Green. At this time, I would like to turn the program over to the chair of the TSHP Awards Committee, Dr. Megan Garrett, for the TSHP Awards.
Thank you, President Kaiser. Before we begin, I would like to take this opportunity to recognize and thank the members who currently serve on the TSHP Awards Committee: Dr. Melissa Burke, Dr. Alicia Carver, Dr. Jamie Chapman, Dr. Larry Shepard, and Dr. Jessica Wallace. Our first award is the TSHP Residency Program of the Year Award. To be eligible, the program has to demonstrate sustained service and accomplishment through innovative services and activities developed as a result of the program, and demonstrate contributions in the area of health system pharmacy practice, such as change in practice at the institution, innovative research, and/or residency project publications. This year, TSHP is honored to recognize Regional 1 Health PGY2 Ambulatory Care Residency Program with this award. Over the past 2 years, ambulatory care residents of Regional 1 Health have helped facilitate expansion of pharmacy services in a major way. Patients are now seen in pharmacist-run clinics for HIV pre-exposure prophylaxis, or PrEP, hepatitis C, outpatient parenteral antibiotic therapy, and 3 new clinics for hypertension, diabetes, and hyperlipidemia management. Aside from this expansion, ambulatory care residents fulfill a wide array of roles within the health system pharmacy practice. Through the specialty pharmacy, residents are exposed to several clinics working with multiple disease states and disciplines, including sickle cell, rheumatology, and pulmonology, to name a few. Outside of traditional ambulatory care roles, residents may participate in inpatient rounding with the internal medicine team or triaging patients in a primary care role with the emergency department. Ambulatory care residents of Regional 1 Health also have multiple opportunities to serve as pharmacy educators in the health system and the community. Medical residents and attendings are educated on screening for patients appropriate for PrEP therapy in the clinic, with plans to expand to health fairs in the future with the PrEP initiative. Leadership experience and professional roles with the Mid-South College of Clinical Pharmacy and the TPA Collaborative Practice Committee are offered, and residents routinely volunteer for the community at health fairs, including the Mid-South Mission of Mercy, providing for the underserved of the Mid-South area. TSHP congratulates the Regional 1 Health PGY2 Ambulatory Care Residency Program, as well as Dr. Drew Armstrong, who serves as the program director, for their outstanding work and contributions to patient care and pharmacy practice.
Hello, everyone. Thank you so much. I'm so honored to receive this award from TSHP for Residency Program of the Year on behalf of my residency team. I've always had a desire to teach that was ingrained in me early on in my pharmacy education, thanks to the amazing preceptors and teachers that I had both in pharmacy school and in my residency years. There have been so many people that have helped me along the way in developing and growing this residency program. First and foremost, I have to say thank you to Kay Ryan and Marilyn Lee. They've been amazing mentors to me and have helped develop me into the clinical pharmacist I am today. They welcomed me into the Regional 1 Health family 8 years ago as a PGY1 AmCare resident, and then again 6 years ago as a clinical pharmacist. They have nurtured my leadership skills and have given me amazing opportunities to grow as a pharmacist. I am truly grateful for their support, and I know I would not be the pharmacist I am today without their help. But also I have to thank my amazing group of talented preceptors who've helped me along with this journey. Gail Heyman and Jennifer Campbell. They also taught me as a PGY1 resident, but they've given me amazing support and friendship throughout this often stressful experience. They've been amazing mentors to me as well as to our residents. To all my other amazing preceptors, Clark, Justin, Paula, Megan, Kimberly, Al Young, and Christy, thank you so much for all your hard work and dedication. This program literally could not exist without your help, and I'm forever grateful for that. I also want to say thank you to our residents, both all past, present, and future. You all have been amazing to work with and have helped contribute to the success of this residency program, and I look forward to working with you in the future. Thank you again for this honor.
Congratulations, Dr. Armstrong, and this incredible team. Our next award is the TSHP Innovative Health System of the Year. This award is presented annually to a pharmacy staff who has advanced the level of pharmacy services within their health system. This year, TSHP is honored to recognize Blount Memorial Hospital under the direction of Director of Pharmacy, Dr. Rob Lucas, for this award. Blount Memorial Hospital has experienced tremendous growth and success despite the global pandemic. In the last 2 years, the pharmacy has completely overhauled the drug distribution system and converted to new automation and workflow processes, as well as implementation of clinical support surveillance system. Working in collaboration with executive staff, Blount Memorial was able to design and develop 2 new ambulatory care services, leading to improved patient care in the community. When the COVID pandemic hit, the pharmacy was at the forefront, leading initiatives to deliver care with COVID treatments, medication management, MAB infusion, and vaccine clinics. Their shared rotating model for providing critical care and emergency department pharmacy specialists on the weekends was implemented in mid-2019, enhancing performance and impact of critical care pharmacists. Internal medicine services pivoted from daily rounds with hospitalists to rounding with the pulmonology team to assist in managing medications in the heavy volume of COVID patients. The pharmacy management team has made a push during the past 2 years to identify and financially support pharmacy staff gaining advanced training in specialty areas, such as sterile compounding, nutrition support, medication histories, and the pursuit of additional certifications in patient safety and pain management are underway. One of the most significant pharmacy research projects during the past 2 years was a project entitled Outcomes Associated with Changing from Microscan to MALDI-TOF Phoenix Technology in a mid-sized community hospital. This resident-led study of 137 patients revealed a significant decrease in time to organism identification from 24 hours in the microscan group to 6 hours in the MALDI-TOF Phoenix group, significantly improving patient care. TSHP congratulates Blunt Memorial Hospital, Dr. Rob Lucas, and his team for their outstanding work.
Hello, my name is Rob Lucas, and I'm Director of Pharmacy at Blunt Memorial Hospital in Maryville, Tennessee. I am so excited to humbly accept the Innovative Pharmacy Practice of the Year Award on behalf of our 65 team members in our pharmacy department. And I do want to thank TSHP for the opportunity to be recognized for all the great work that our pharmacy team members have done throughout the year. Would like to also recognize our amazing team. We've been unified in our desire to push beyond the expected, beyond the minimums, and reach for greatness to make some incredible leaps forward to improve quality and safety and expand pharmacy services and ultimately outcomes in medication therapy for patients. So we have an amazing pharmacy leadership team, dedicated technicians, brilliant pharmacists, eager and driven pharmacy students and interns, and an office coordinator. I would like to thank one of my mentors, Jeannie Ezel, for nominating us, and also thank some of the other directors throughout the state who I've leaned on over these past few years. We have had some great successes over the past 24 months, including some USP 800 construction and renovation throughout the hospital and the pharmacy department, complete upgrade in all technology, including Omnicell. We went from a decentralized model to a centralized model. We expanded ambulatory care to 3 pharmacists, and we'd never been in the ambulatory care environment before. We got very creative with students during COVID, and we actually increased the number of students during the full year of COVID. We did some creative things to reduce burnout and increase employee engagement, some monthly activities that seemed to work very good. So I'm very proud to work with some professionals who are aspiring for greatness and constantly looking to improve care and ride that wave of change with flexibility and adaptability. So but things are changing so fast, and when the winds of change blow, then you build windmills, right? But if nothing changes, then nothing ever changes. So the same goes with pharmacy. And so Thomas Edison said the value of an idea, it lies in using it. So don't just change something just to change something, but also don't be comfortable with the status quo. A lot of people are looking for meaning and purpose in their lives, in their work environment, in their job. We can have that. We can all have that. Be creative. Push the limits. Do it for our patients. They deserve it. Again, thank you very much.
Congratulations, Dr. Lucas and the Blunt Memorial Hospital pharmacy staff on all of your achievements. Our next award is the Pharmacy Technician of the Year Award, which is given to recognize exemplary pharmacy technician practice. Pharmacy technicians provide essential support to pharmacists and enhance the delivery of patient care and services every day here in Tennessee. As pharmacists pursue formal recognition for their roles in the delivery of patient care and integrate into larger healthcare teams, our pharmacy technicians will continue to play a vital role in the advancement of pharmacy practice. This year, TSHP is proud to recognize Ms. Tamika Watkins as Pharmacy Technician of the Year. Tamika received her pharmacy technician certification in 2006. After working in various pharmacy technician capacities at other pharmacy facilities, she became a technician at Methodist Le Bonheur Hospital in 2013. She has taken on many roles since being at Methodist Le Bonheur Hospital Pharmacy, such as Automation Specialist Certified Pharmacy Technician, Lead Pharmacy Technician, and presently as Pharmacy Technician Supervisor. Tamika is a recognized problem solver and superior communicator and is able to handle complex projects. She says of herself that she has a belief in superior patient service standards and approaches her days with a patient-first attitude. She is also a champion for transcultural diversity, enhancing cultural awareness and sensitivity at the hospital. She also serves as band president and vice president of publicity for the PTA at her son's school. TSHP congratulates Tamika for her outstanding work and contributions to patient care and pharmacy practice.
Good morning. I am overjoyed with gratitude to have been selected as the Health System Pharmacy Technician of the Year. I am honored to have my work recognized by the members of the Tennessee Pharmacy Association. First and foremost, I would like to thank my family for their love, understanding, and patience for allowing me to work challenging hours with my team. I would also like to thank my technician team for the daily support to ensure our nurses are ready to provide medications to our patients in a timely manner. During the past year, as a team, we have learned so much about our current COVID pandemic. We have learned new COVID guidelines concerning PPE, how to deliver medications safely to our COVID floors, and we have also provided vaccine clinic resources to our community and patients within the past year. I also would like to thank my pharmacist leadership team for providing departmental teamwork and patient support. I will continue to incorporate positive changes in our pharmacy to provide excellent patient care. In closing, I will leave you with a quote from Maya Angelou. Success is liking yourself, liking what you do, and liking how you do it. Thank you.
Congratulations, Tamika, on your outstanding achievements. The next award is the TSHP Health System Pharmacist of the Year. This award is presented annually to a TSHP member who has made significant contributions to the pharmacy and health system practice and who has demonstrated exceptional leadership qualities. This year, TSHP is honored to recognize Dr. Mark Sullivan. Dr. Sullivan is the Associate Chief Pharmacy Officer of Vanderbilt University Medical Center, VUMC, where he oversees pharmacy operations for the adult, psychiatric, and rehabilitation hospitals, as well as on- and off-site clinics. During his time in this role, Dr. Sullivan directed transformation of the deployment of pharmacists and technicians to a patient-facing, integrated model supporting providers and nurses. He has served on a variety of professional committees and received multiple honors and awards due to his leadership and example. In May of 2020, the Tennessee Department of Health partnered with VUMC to distribute their initial supply of remdesivir to hospitals and patients across the state. Dr. Sullivan was part of a small team of physician and pharmacist experts that collaborated with the Tennessee Department of Health to establish this distribution process. Dr. Sullivan became the point intake for requests and interfaced with directors of pharmacy across the state. He worked with the Tennessee Department of Health to ensure proper data submission related to COVID monoclonal antibody inventory and utilization at VUMC and led frequent meetings with VUMC pharmacy leadership on COVID-related topics, ranging from investigational studies to state and hospital metrics. He and his wife, Lori, have 2 daughters, Katie Nerona and Emily Burgess, and 1 grandson, Jude Burgess. TSHP is proud to honor Dr. Sullivan with the Health System Pharmacist of the Year Award for his outstanding work and contributions to patient care and pharmacy practice.
Hello, TPA pharmacy friends. I'm honored to receive this year's award for Hospital Pharmacist of the Year. Thank you to TPA, to the awards committee chair, and to the members for your work this year. I count myself fortunate to have been mentored by exceptional pharmacy leaders and want to recognize at this time Richard Payne, Carmen Leffler, Steve Huffines, and Jim Heyman for their guidance during my career. Mentors are so important to us, and let's not take them for granted. I also count myself fortunate to work with an exceptional team of pharmacy leaders, pharmacy clinicians, and staff, and want to take this opportunity to thank them for the support that they provide to our patients every day. And lastly, I want to take a moment to thank my wife, Lori, and my family for their support. Having a comfortable and safe place to go where you're loved at the end of the day is an important thing for your self-being, and I just want to thank them for all that they are in my life. When I think back to the sterile products advancements we made in 2012 or the push for collaborative practice in 2014, or the rise of COVID and the introduction of treatments like remdesivir, the monoclonal antibodies, and now the vaccine, the role of the health system pharmacist in practice to provide for the quality and safety of medication use in our patients has never been more important. The value of TPA and the network that we have to support and learn from each other is critical to the care we provide for our patients across the state. Please join me in not taking TPA for granted in our practice, and please join me in not missing an opportunity to talk about the value of health system pharmacy to our patients and our colleagues. To my health system colleagues across the state, thank you for your efforts on behalf of our patients. To my retail and ambulatory and other pharmacist colleagues across the state, thank you for all you do. I've never been more proud to be a pharmacist. Thank you.
Congratulations, Dr. Sullivan. The next TSHP award is the Distinguished Service Award. This award is presented annually to an individual in recognition of their sustained service and significant accomplishments in the span of 20 or more years. This year, TSHP is honored to recognize Dr. Kay Ryan with this award. Dr. Ryan served as Director of Pharmacy Services at Regional One Health from 1981 until 2020. In 2020, she was promoted to Vice President of Outpatient and Specialty Pharmacy at Regional One Health. As one of the longest-serving pharmacy directors in the state of Tennessee, Dr. Ryan's influence is profound in serving as a mentor to countless students, residents, and pharmacists. Beyond her impact in the pharmacy health system, she has remained a tireless advocate for her profession at the state and national level. She served as TPA president from 1991 until 1992 and has served as chair for multiple committees within ASHP, TSHP, and TPA. Dr. Ryan is also a current fellow of ASHP. She and her husband Mike have been married 39 years, and they have two daughters, Mary Michael Ryan and Sarah Catherine Ryan Formiller, who is also a pharmacist, and they have a granddaughter, Sadie Kay, who was born in 2020. TSHP congratulates Dr. Ryan for her distinguished service with significant contributions to her profession.
I would like to thank the Tennessee Pharmacists Association and its leadership team for selecting me for this special recognition and humbling award. Thank you. I've been so blessed in my career to serve as the pharmacy director at Regional One Health for almost 40 years. Regional One Health has a rich history in our teaching associations with the University of Tennessee, and we've been able to build programs and to expand services, not only for our inpatients, but for our ambulatory patients as well. I've been blessed with an amazing team of committed professionals who have a passion for serving and improving patients' needs. I want to say a special thank you to my immediate family, Mike Ryan, Mary Michael, and Sarah Catherine. You are so special to me. You've allowed me the opportunities to travel and to be in other meetings and miss your events, and I hope you have forgiven me over these years, so thank you. I'm extremely grateful to my dear friend and work colleague, Marilyn Lee. We have worked together to build pharmacy services for over 35 years. Without Marilyn, our services at Regional One would not be anywhere near what they are today. I also want to express my deep appreciation for my dear and constant friends, Bettina Black, Diane Duncan, Jim Oaf, and Ken Roberts. Thank you for always being at my side. Thank you. I'd like to thank TPA one more time for this special recognition. I am so humbled. I'm so proud of the work that you are doing. I'm proud of our leadership, and I can't wait to see what you get done in the next 3 to 5 years. Thank you.
Congratulations, Dr. Ryan. I will now turn it back over to President Kaiser.
Thank you, Dr. Garrett and the TSHP Awards Committee. We will now move into the TPA Awards. But before we present the award winners, I would like to begin by recognizing and thanking the members of the 2021 TPA Awards Committee. The members of this committee are Dr. Leslie Hamilton, Chair, Dr. Jason Green, Dr. Jody Taylor, and Dr. Olivia Waters. These individuals had many very deserving candidates to consider this year, and we thank you all for submitting award nominees, and we encourage you to nominate again next year. Our first award is the TPA Partner in Excellence Award. The TPA Partner in Excellence Award provides visible recognition to an organization, association, or other entity that has worked closely with the TPA to improve patient outcomes, promote patient safety, increase the quality of care within the healthcare system, and elevate the standards of pharmacist-provided patient care. This year, TPA is honored to recognize the Tennessee Department of Health's Vaccine Preventable Disease and Immunization Program, or VPDIP. This time last year, TPA began engaging with the VPDIP team to start discussing pharmacy's involvement in the COVID-19 vaccine. They recognized early on the role of the pharmacist and pharmacy technician in the hospital, long-term care, and community setting. They engaged the TPA to determine how to get as many pharmacy teams involved as possible, which allowed TPA to develop strong relationships with the VPDIP over the next several months. When faced with issues, they would turn to partners in the community for input and leaned heavily on other organizations to get the vaccine out as quickly and as equitable as possible. TPA thanks VPDIP for their hard work and dedication over the past year and looks forward to the continued partnership. TPA staff would like to thank Dr. Shelley Fiskus, Dr. Christopher Wilson, and Dr. Vicki Reed specifically for their assistance during this time. Congratulations and thank you to all of the Vaccine Preventable Disease and Immunization Program team members for their tireless work throughout the pandemic. Next, we are excited to present the TPA Distinguished Young Pharmacist Award. This award, sponsored by Pharmacist Mutual Insurance Company, was established to encourage newer pharmacists to participate in association and community activities and to annually recognize one such professional who takes initiative, shows leadership, and has a unique talent for patient care. We are so grateful to Pharmacist Mutual Insurance Company for their continued support. I will now turn it over to Jim Hall to present the award.
The Distinguished Young Pharmacist Award was created in 1987 to encourage newer pharmacists to become involved in association activities and community service. This award recognizes one pharmacist in each state for individual excellence and outstanding contributions. This prestigious award is presented by the Pharmacist Mutual Companies, nationally recognized as leaders in providing insurance products and risk management solutions to pharmacy professionals. This 2021 Tennessee Pharmacists Association recipient was selected by a committee of his peers, and this pharmacist exemplifies and exceeds the criteria required. His contributions to the profession of pharmacy are numerous, both on a state and national level. Here are just a few examples. He has worked for St. Louis Family Medicine Center since 2017 as an ambulatory care clinical pharmacist specialist. In this role, he provides comprehensive medication management services to patients with chronic conditions under a collaborative practice agreement. Recently, he was promoted to supervisor over all of the ambulatory care pharmacists within Ascension Medical Group, Tennessee. He was the first pharmacist in Tennessee to successfully credential with a commercial payer and receive reimbursements for an EM office visit under the 2017 Tennessee Pharmacist Provider Status Law. He was also an early participant in the TennCare MTM pilot program and is one of the most active participants or pharmacists participating in this program. In 2020, he was the UTHSC College of Pharmacy's Middle Tennessee Preceptor of the Year. And lastly, amidst the global pandemic, he is quick to pivot his robust ambulatory care practice to demonstrate the essential role of ambulatory care pharmacists in maintaining attention to chronic conditions. As evidenced by these numerous accomplishments, our 2021 Tennessee Young Pharmacist of the Year is Dr. Jonathan Hughes.
Good afternoon, TPA. It is a great honor to receive the Distinguished Young Pharmacist Award, and frankly humbling when you consider the eminent past recipients of the award. This list of those who have supported me in this achievement could go on for far longer than I have time to speak, so without further delay, please allow me to thank a few. First of all, the first person I share any glory with is my wife, Katie, whose name should be on every diploma, award, and certificate I own. Since the fourth day of pharmacy school, Katie has been the knot that has tied our family together. Second, I'd like to recognize the long list of professional mentors whose investment in me as a pharmacist has produced the return that is being recognized in this award today. In particular, I'd like to thank Sean McFarland, who showed me that diligent leadership and advocacy is not just about politics, but about designing clinical services and policies that open the doors for connections between a pharmacist and patients so that those patients can get the care that they deserve. Next, I'd like to thank Tim Morgan. When you consider that our practice styles are a mosaic of the clinicians who've trained us, Tim's influence on my practice is unmistakable. Tim's generosity, whether it was lunch at Koji or an hour-long topic discussion at the end of a busy day, came with only one condition, to pay it forward. And that's a commission I haven't taken lightly in the past 4 years since I finished residency. Next, I'd like to thank Ascension St. Thomas, and in particular, Julie Hudgens, for supporting the growth of our ambulatory care pharmacy service. There have been several times over the past couple of years where it would have been far easier as a leader to say, well, let's not make waves, or maybe this isn't the right time for this right now. But Julie has never been one to pull back on the reins, but rather to pull me left or right to help me navigate an obstacle rather than just crashing into it. Finally, I'd like to thank the Tennessee Pharmacists Association, and in particular, Micah and Lucy. Warriors and even pharmacists are willing to lay down their lives, or in this context, their careers, when they see their leaders fighting passionately alongside them on the front lines. Thank you, Micah and Lucy, for being those kinds of leaders. Next, I'd like to thank the larger association body for being a network of engaged pharmacists wherein we can learn from each other and push in the same direction to achieve our goals. And then last but not least, I'd like to thank each and every one of my colleagues that I work with, especially Chelsea Renfro and Rebecca Hopper, who were so kind as to nominate me for this award. Once again, thank you, TPA, for recognizing me at the beginning of my career, my race as a young pharmacist. I will continue to work hard and to finish this race well for this career and profession. Thank you.
Congratulations, Dr. Hughes, and thank you again to Pharmacist Mutual and Jim Hall for their continued support and for sponsoring this prestigious award. Our next award is the Excellence in Innovation Award. This is a national award coordinated by the National Alliance of State Pharmacy Associations and generously sponsored by Upshur Smith Laboratories, LLC, to recognize and honor a qualified pharmacist who has demonstrated significant innovation in their respective practice, method, or service directly or indirectly resulted in improved patient care and/or advancement of the profession of pharmacy. The tradition of designing innovative pharmaceuticals has been the commitment of Upshur Smith Laboratories and is driven by the ever-changing needs of patients, physicians, pharmacists, and healthcare organizations. Their perspective is not more products, but the right products that make people's lives better. At every level of their business, they are driven to be the best. This year's Excellence in Innovation Award recipient is Dr. Jason Vincent. Dr. Vincent earned his Doctor of Pharmacy degree at the University of Tennessee Health Science Center in 2003. Dr. Vincent serves as the Director of Pharmacy and Medication Safety Officer at St. Francis Hospital Bartlett from 2007 to 2017, after which he served the Market Director of Pharmacy and Market Safety Officer from 2017 to 2019. In 2019, Dr. Vincent formed his own company, Specialty Consultative Pharmacy Services, LLC, and is contracted with Mike Polito, a dentist in Germantown, Tennessee. In this unique practice, Dr. Vincent performs medication therapy management, antibiotic and opioid stewardship, and is involved in education and initiatives for medications used in dentistry. In addition, Dr. Vincent serves as a preceptor for the University of Tennessee Health Science Center College of Pharmacy and Union University College of Pharmacy. He is also involved in multiple committees in both TPA and TSHP. TPA and NASPA is proud to congratulate Dr. Vincent for his outstanding work and contributions to patient care and pharmacy practice.
I cannot express how honored we are to be recognized for this dental pharmacy collaboration. As a pharmacist starting something completely new, I have to give a great deal of credit to Dr. Polito for seeing the potential of pharmacy services to help his very busy practice and his very diverse and multi-generational patients. Currently, we are working with TPA for a change in Collaborative Practice Act to include dentistry and pharmacy to expand our services. Meanwhile, Dr. Polito allows my services, and my pharmacy students to review patient medications and create a potential oral side effect profile for each patient. We provide general drug information, guidance on antibiotic and opioid selections, and guide when patients have medication allergies. We even do the blood pressure screenings for the office. In doing this, we're able to impact patients who may not see a regular physician often, but may see the dentist 2 or more times per year.
Hello, I'm Dr. Mike Polito. I feel my patients benefit from the adoption of pharmacy collaboration by being able to ask medication questions they may not have time to ask elsewhere. As my patient population ages and more drugs come out every year, pharmacy is able to assess my patients' meds for potential oral side effects and help possibly prevent future complications.
From the Office of Mike Polito, DDS, thank you again for recognizing our efforts to collaborate for the care of our patients.
Congratulations, Dr. Benson. Our next award is the Tom C. Sharp Pharmacist of the Year Award. The Tom C. Sharp Pharmacist of the Year Award is presented by the Tennessee Pharmacists Association in honor of Tom C. Sharp Sr. and Tom C. Sharp Jr. to provide recognition to a member who has served as a distinguished ambassador for the profession of pharmacy. Named for 2 individuals that dedicated their lives to advancing TPA and its executive leaders, the association continues to honor the legacy and contributions to the professions made by the Sharps by celebrating the achievements of an individual who exudes excellence in the areas of teaching, patient care, leadership, service delivery, and advocacy for the profession. This year, TPA recognized Dr. Jennifer Twilla as the Tom C. Sharp Pharmacist of the Year. Dr. Twilla is the Interim Director of Pharmacy at Methodist University Hospital in Memphis, Tennessee. She received her Doctor of Pharmacy degree in 2008 from the University of Tennessee Health Science Center. She completed a PGY1 residency at the Veterans Affairs Medical Center in Memphis, Tennessee, and a PGY2 residency in internal medicine at Methodist University Hospital in Memphis, Tennessee. She has previously served as the residency program director at Methodist University Hospital. During her tenure as RPD, the Methodist University Hospital residency program earned the American Society of Health System Pharmacists Foundation Award for Excellence in Residency Training and the Tennessee Society of Health System Pharmacists Residency Program of the Year. She is a former secretary of the TSHP and the former president of the Mid-South College of Clinical Pharmacy. Her contributions to patient care in internal medicine and congestive heart failure have been recognized with the Clinical Practice Award from the American College of Clinical Pharmacy and the TSHP Health System Pharmacist of the Year. Additionally, she regularly contributes to the global body of literature and has authored over 35 peer-reviewed publications in medical and pharmacy journals. Dr. Twilla served as Interim Director of Pharmacy at Methodist University Hospital during the COVID pandemic and was selected to lead community vaccination efforts for the entire Methodist healthcare system, overseeing over 15,000 vaccinations for Methodist University Hospital to date. She has been married to her husband, Brad, for 20 years and has a 2-year-old son, Harrison. TPA congratulates Dr. Twilla for her outstanding work and contributions to patient care, leadership, and pharmacy education and practice.
So excited and honored to be receiving the Tennessee Pharmacists Association Tom C. Sharp Pharmacist of the Year Award. It's certainly been an exciting and challenging year for me, with taking on interim director of pharmacy role to rolling out COVID vaccines across the system, as well as turning 40. With all that, I've had significant amount of love and support from friends and family, and I truly value their support. Also, when I reflect back on my career, Dr. Richard Brown certainly believed in me as a young PGY1 when I didn't really know to even believe in myself or what I was capable of. So I'm grateful for his investment in me. And then Dr. Self really showed me a different side to teaching and really looking at life with all of his passion and enthusiasm, and definitely his passion for research and publication definitely rubbed off on me. And so I'm grateful that I had the opportunity to learn from someone who was so excited about that aspect of our profession. And then last but certainly not least, I definitely appreciate all that Dr. Chris Finch has done for me in my career. He's not only been a dear and close friend of mine, but he's also been one of my biggest supporters. And he's also very innovative and one of the most inspirational people that I've worked with in my career. And so I definitely appreciate his influence that he's had, and certainly appreciate him nominating me for this award. And just everyone that has played a part in any success that I've had, I'm truly, truly grateful. And again, I'm so thankful and honored to be receiving the award this year.
Congratulations again, Dr. Twilla. Our next award is the Bowl of Hygeia Award. It is the most widely recognized international symbol of pharmacy and derives from Greek mythology. Hygeia was the daughter and assistant of Aesculapius, the god of medicine and healing. Her classical symbol was a bowl containing a medicinal potion, with the serpent of wisdom or guardianship partaking of it. This is the same serpent of wisdom that appears on the caduceus, which is the symbol of medicine. The Bowl of Hygeia Award is presented annually by participating pharmacy associations in each of the 50 states, the District of Columbia, Puerto Rico, and the 10 Canadian provinces. The recipients are selected by the respective associations for their outstanding record of community service. The Bowl of Hygeia Award is sponsored by the American Pharmacists Association Foundation and the National Alliance of State Pharmacy Associations. In 1960, E. Boyd Garrett from Nashville was the first pharmacist honored by the TPA with one of pharmacy's most prestigious awards. This year's recipient for the Bowl of Hygeia Award is Dr. Tom Markham. Dr. Markham has served in various capacities throughout his distinguished 40-year pharmacy career. Those roles include Vice President and Pharmacist of Markham's Pharmacy, Vice President and Director of Pharmacy of Markham's Home Care, and General Manager and Clinical Pharmacist of American Home Patient, all in his hometown of Manchester. He graduated with high honors with a Bachelor of Science in Pharmacy from the University of Tennessee College of Pharmacy in 1980 and earned his Doctor of Pharmacy in 1982, where he was both Vice President of his Doctor of Pharmacy class and was awarded the Dean's Award and Upjohn Achievement Award. He has provided decades of service to his profession as the District 5 President, as well as preceptor for the University of Tennessee College of Pharmacy and Lipscomb University College of Pharmacy. Dr. Markham has consistently invested in the future of his community, and he was a charter member of the Coffee County Educational Foundation, Hospice of the Highland Rim, and the Coffee County Drug Court. He has been an ardent supporter and participant in community theater in both Coffee and Cannon counties. His acting roles have included Captain Hook in Peter Pan, Simeon and Joseph in the Amazing Technicolor Dreamcoat, Charlie Anderson in Shenandoah, and George Banks in Mary Poppins. Dr. Markham is also an active member of Forest Mill Church of Christ, where he serves as a Bible teacher and worship leader. He has been involved in numerous ministries, including youth activities, group singing at the local jail, medical missions to Panama, and providing music for countless funerals, and often officiating the service for church family, friends, and patients. Dr. Markham and his wife, Elaine, have 2 children, Brian and Allison. TPA is honored to recognize Dr. Tom Markham as this year's Bowl of Hygeia Award recipient.
When I heard I was receiving the Bowl of Hygeia Award, I was truly surprised and honored. There are many people who have helped me through my life and career. My dad and uncle were both pharmacists, and I've had the privilege for many years working with my pharmacist brother, Ray Markham. He says that he is my calming influence. I want to thank them. I want to thank my wife, Elaine, who has been supportive and has made our home a place where I always wanted to be at the end of the day. In my career, I've had these brushes with greatness, and that's where my life has intersected with people who have been outstanding in their areas of expertise. I have received wisdom and encouragement from them, and I can't mention all of them, but I'd like to mention some representatives. At the College of Pharmacy at the University of Tennessee, Doctors Tim Self Rich Helms, Loria Conchas. I think of Quentin Cernka, Peter Chaika, Roger Davis, and Phil Johnston. And my PharmD classmates, Dr. Stephanie Phelps, Michael Christensen, Raleigh Dickerson, Richard Thompson, Tony Powers. And the coworkers that I've been working with lately, the doctors Richard Randolph and Michael Barnes, Kim Roberts, Chris Bowens, Julie Grosh. And there's many other pharmacists and technicians that I've had the privilege of working with. I'm grateful for. I also want to thank the Tennessee Pharmacists Association and their staff for how they've served our profession for many years. And if you're watching this and you're not a member of the association, I can't think of a better investment in your profession than to be a member of the Tennessee Pharmacists Association. It's an organization worthy of supporting. About 2.5 years ago, I had a heart attack. I got to the hospital, and as soon as I got on the exam table, I arrested. They performed CPR and eventually got me hooked up and shocked me back. I immediately arrested a second time. They were able to bring me back. And then as I was being rolled to the cath lab, I arrested again in the hallway. And thankfully, they were able to revive me again. I got into the cath lab. The cardiologist identified the offending artery and placed a stent. After the hospitalization, I went for my follow-up exam to the cardiologist, and I told him, I'm thankful that you saved my life. And he quickly said, "Oh no, I did not save your life." He was implying that I had been the recipient of another measure of God's grace and goodness. He said I was just doing my job. I told him, "Well, thank you for doing your job well." And after that hospitalization, I was just grateful and thankful for all the work that the people had done for me. Everyone at the hospital was competent and caring, except for the admissions clerk, who, when I told her, "I really think I'm having a heart attack," she said, "You've got to wait your turn." But the physicians and the nurses, pharmacists, lab technicians, the CNAs, the transporters were all compassionate and competent with the care they provided. And that's really what I want it to be. And that's what I want our students to be that rotate through our location, and our profession as a whole to be competent and caring people who do their jobs well. I thank you for presenting me with the Bowl of Hygeia Award this year. I'm truly honored, and I'm grateful for your kindness.
Congratulations, Dr. Markham. I will now turn it over to Ms. Haley Watson, President of TSSP, to present this year's TSSP Awards.
Thank you, President Kaiser. The first TSSP Award is the Student Allegiance Award. This award is presented annually to a final year pharmacy student with a minimum of 2 years of continuous affiliation with TSSP who has not served as president or president-elect, who has demonstrated unusual devotion to TSSP and through their outstanding contributions has directly benefited TSSP, TPA, or both. This year's Student Allegiance Award recipient is Alex Schwanner. Alex, an exceptional supporter of both TPA and TSSP during his time as a student pharmacist, served as a MAL for 2 consecutive years and talked up TPA, TSSP to incoming and current students, making them more aware of policy and advocating for our future profession. Alex was also a great representative of the college and student pharmacists as a whole. He put TPA, TSSP, policy, and advocacy on the radar of anyone that would listen. Alex was treasurer of Kappa Psi Fraternity and VP for Phi Lambda Sigma. He also conducted interviews for College of Pharmacy ambassadors and interviews for both MALs and delegates of TSSP. I know that he will represent us well in Florida next year at his residency, and thank you for your service to TPA and TSSP during pharmacy school, and we wish you the best of luck in the future. Congratulations again, Dr. Alex Schwanner.
Hello, TPA. Alex here. Just wanted to say how honored I am to receive this award. TPA means the world to me, and the time that I spend as member at large for TSSP really were some of the best moments of pharmacy school for me. Whether it was from the numerous summer meetings and winter meetings and days on the Hill, those will always be some of the most fun and exciting moments in pharmacy school, especially spending it with all of my wonderful colleagues and classmates. Now, even though I'm about to start my residency down here in Florida, TPA and Tennessee will always hold a very special place in my heart, emotionally and career-wise. So with that, I look forward to keeping in contact with everyone that I was able to meet and have the pleasure of spending time with over the past 4 years. And with that, I want to say thanks again and have a great rest of the summer meeting.
Our final award of the afternoon is the Student Advocacy Award. This award is presented annually to a professor, preceptor, or other pharmacist who has demonstrated devotion to the success of student pharmacists through a commitment of lifelong leadership which directly encouraged, inspired, and facilitated the development of TSSP organization members to perform to their fullest potential. This year's recipient of the TSSP Student Advocacy Award is Dr. Brad Spencer. Dr. Spencer has been such a wonderful role model for the students of Union University College of Pharmacy. To start, every year Dr. Spencer talks to the school about advocacy. He goes in depth and breaks it down so that anyone can understand it, and also the importance of being a lifelong advocator. He always talks about ways students can actively advocate for ourselves and the people around us. Dr. Spencer has done everything possible to encourage students to stay involved and support any pharmacy involvement, no matter how small. He has helped with fundraisers, events, meetings, service events, including vaccine clinics and voter registrations. We appreciate his continued support of educating student pharmacists. Congratulations again to Dr. Brad Spencer.
I first want to say thank you to the Tennessee Society of Student Pharmacists for selecting me for the Student Advocacy Award. I'm humbled to be considered, as I don't feel that anything I have done is worthy for such consideration, but I do thank you for the recognition nonetheless. As I somewhat begrudgingly became involved in advocacy in a semi-formal capacity during my time in pharmacy school, I only thought of it as contacting legislators to influence votes. Over my years, though, I have come to view advocacy as something every one of us can do on a daily basis. Advocacy, while it is sometimes contacting legislators or regulators and providing your perspective, is also much more than that. It is helping educate other healthcare providers as well as patients as to what pharmacists can do. It's expanding your knowledge and abilities to demonstrate the expertise that we have in order to best serve our patients. Ultimately, though, we all know that pharmacy is heavily controlled by legislation and regulation. So, believe me, if we aren't advocating for ourselves in the many faceted ways that may look like, someone else will be attempting to influence how pharmacy is shaped. It's up to us, and it's up to you as the next generation of pharmacists. Thank you again for this recognition, and I look forward to working alongside you as we mold our profession, and also look forward to seeing how you will grow us as healthcare professionals.
Congratulations, Dr. Spencer. I will now turn it back over to President Kaiser.
Thank you, Haley. TPA would once again like to thank Morris and Dixon for their support of this year's award ceremony. I also would like to congratulate all of this year's award winners. It is wonderful to hear about all the fantastic things our TPA members are doing to advance the profession of pharmacy and impact the lives of others. Thank you all for joining us to celebrate all these wonderful individuals and organizations.